Good day. I'm Dr. John Ward, Director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health in the United States. It's my pleasure to be part of this program today to give you an overview of the essential components of programs developed to eliminate hepatitis as public health threats in countries around the world. Now, we're very fortunate to have elimination goals for hepatitis B virus and hepatitis C virus, which are major causes of disease and mortality around the world, as I'll show you in a moment. With the endorsement of the World Health Assembly, WHO developed goals for the elimination of hepatitis as public health threats, defined as a 90% reduction in incidence, 65% reduction in mortality by 2030. Which, as you can see here, would have a dramatic improvement in public health and averting deaths from hepatitis. Hepatitis is a large public health problem. There's an estimated 58 million people living with chronic hepatitis C with different prevalences as shown around the world by WHO region. As you can see here, about 20 countries represent 3/4 of the burden of hepatitis C, and including the country of Vietnam. Now, multiple financial models have shown the cost effectiveness, if indeed cost saving, that can happen when you have effective hepatitis elimination globally. And for a relatively small investment, there can be large reductions in the number of deaths from hepatitis and improvements in the quality of life. And that cost effectiveness, cost saving ratio only improves over time because of reductions in the cost of testing, treatment, and care in many countries. And indeed, what were once considered very, very high-cost therapies for hepatitis C, which cure 95% of infected people, have fallen dramatically in price around the world, with almost 2 out of every 3 people living with hepatitis C living in countries where the drugs cost less than $150. As a result, the percentage of people who are living with hepatitis C who are aware of their status has increased, as has the number of people treated, although we have a long way to go to reach those global elimination targets. At the same time, care has become much simpler because of the safety and high cure rates of these drugs that only need to be taken once a day for 2 to 3 months. You need very little oversight, and so this care can be managed at the primary care level. All that to say, as programs have been developed, what has emerged are the essential components of effective hepatitis elimination programs that include the importance of strategic information for planning and to monitor how well programs are performing. As needed, international assistance to get the whole campaign started, a national action plan with policies for vaccination, testing, and treatment, local coalitions, civil society, expert clinicians, public health, integrating hepatitis services within existing health systems, having attention to financing for the whole operation, and then be open to operational research to improve how well programs are working and to bring in new technologies as they become available. Probably the prime example of those essential components is the hepatitis C elimination program in the country of Egypt, which 15 years ago had the highest prevalence of any country in the world for hepatitis C. And about 4 years ago, the president issued an order that all adults be tested at least once for hepatitis C, which sparked the development of a national campaign. They negotiated a low-cost test and treatments for hepatitis C, as shown in the middle bar on this slide. They implemented a very broad public outreach campaign with education and mobile sites to be tested. with no pay, no cost to patients, and then those persons being referred to very conveniently available treatment sites. In a very short time, the number of people being tested and referred for care rose dramatically, as shown in that line graph. They did benefit from some external support from the World Bank to start the program, but after that, supported it with national resources. And as you can see here, are now treating and curing millions of people with hepatitis C, which is putting the country on the track to successfully reach the WHO targets. Another country that's earlier in that process is Pakistan, where again, using strategic information, they have shown the very large burden of hepatitis C, the rising mortality from the infection. 2 years ago, the government made a commitment to hepatitis C elimination with the support of a variety of civil society groups. They're now putting together feasible interventions to reduce the cost of test and treatment. They have some experiences already to help them develop effective programs, and their financial models indicate that this is a very good value for the country in terms of return on investments in improved health. To help all countries do what Egypt and now Pakistan is doing, the coalition has developed a tool available on our website at no cost, where a country can put in the number of people needed, their burden of disease, their targets for elimination, their cost of tested treatment, and the model will produce a budget-based plan to reach those goals. We released this tool last month, and it's available on our website as shown here, and including, of course, for the country of Vietnam. Now, we don't want to worry, hepatitis B also needs attention. It's a very large global health problem. And people, a variety of different groups are underway to develop financial models for hepatitis B, but they also include these essential components that I have been mentioning. Hepatitis B is important because of its large burden, 296 million people living with chronic hepatitis B around the world, based on WHO estimates, with the largest burden in the countries of Asia. Again, when you look at the burden by the number of countries, certain countries have the largest burden, and again, Vietnam is in that category. And these models are telling us, again, that that burden can be addressed by effective program development. This puts it in firmer numbers in the country. In Vietnam, some of those essential components are in place. You do have strategic information that's showing the large burden of hepatitis B and hepatitis C is shown here. This is the data available on our website. You have some hepatitis C elimination activities going on. You have a national plan. The Vietnam Viral Hepatitis Alliance pilots of micro-elimination in a variety of different settings to identify best strategies for testing and linkage to care. And those micro-elimination projects identify the challenges to be overcome. One example in Vietnam is the relatively high cost of hepatitis C treatments relative to other countries in similar economic categories. The coalition is developing national hepatitis elimination profiles to check on the status of these essential components and see which ones are in place and which ones need to be strengthened with more assistance, so that you can bring that information together and identify the feasible next steps needed to advance progress toward hepatitis elimination. We are launching this on World Hepatitis Day in collaboration with partners in 30 countries. And I'm happy to report that we will be working with colleagues in Vietnam and look forward to developing that profile for Vietnam together. Please go to our website to get more information about the work of the coalition. We have more information there about Vietnam and about the tools that I mentioned today. Look forward to working with all of you, because I know working together, we can achieve hepatitis elimination. Thank you.